Hello and welcome to today's Bright Talk episode, Pivoting Strategies, How Community and Nonprofit Organizations Have Adjusted During COVID-19. We're using Bright Talk, a content marketing platform which allows us to share research, insights, and expertise. As we get started, I want to tell the audience that we're live and interactive. And we want to hear your questions and feedback. Please submit your questions through the player at any time, and we will take them throughout the discussion, and there will be time set aside at the end. I am joined by four distinct community based organization leaders, and we will explore how they have adjusted their strategies in serving the community, in particular, how COVID 19 impacted their work and how the Give Back Cleveland campaign helps support their mission. I am Patricia Terstenyak, Director of Community Health at the Center for Health Affairs. We are a hospital membership association, and we aim to be a convener, influencer, and innovator that impacts health in the communities we serve. I have the honor to serve as your moderator for today. Next to me is Natalie Leek, President and CEO at Providence House. Natalie has been there for nearly 20 years and brings a depth of wisdom and knowledge. Providence House envisions children everywhere are raised in safe, loving families free from abuse and neglect. We also have Andrew Newsome, Strategy Director of Cleveland Can't Wait. Andrew brings so much to the table, and we can't wait to get to know him better. Cleveland Can't Wait is a nonprofit focused on revitalizing Cleveland through civic technology and entrepreneurship. Their mission is to advance economic opportunity and racial justice in underserved neighborhoods across the city. Victor Ruiz, Executive Director at Esperanza, where their work builds the confidence and skills our youth needs to become thriving leaders. Esperanza helps to improve the academic achievement of Hispanics in the greater Cleveland area by supporting students. Last, and certainly not least, is Jessica Waters, President, CEO, Big Brothers Big Sisters of Greater Cleveland. Their mission is to create and support one-on-one mentoring relationships that ignite the power and promise of youth. Let's get started. The first question is for Natalie. Natalie, how has the pandemic impacted the need for Providence House's services? And what are you seeing that some new and different needs than maybe you have not been seeing before? And are there services you've had to add, or conversely, services you needed to scale back or eliminate?
Thank you, Patricia. Providence House is a crisis nursery, so a big part of our service is on-site shelter for children experiencing family crisis. So clearly at the beginning of the pandemic, that was challenging to understand, and we had to temporarily close the children's shelter component of our program so that we could get PPE, understand new care protocols. It is a group living situation, so very much concerns around quarantining children who are ill, staff exposure. So we were temporarily closed our shelter for about 2.5 months while we got all of that organized with a lot of support from our medical community and public health departments. We are operating the nursery again. But during that time, from the very first day we made the decision, we pivoted to virtual services for families. So our families are living in high-risk situations. So we went to phone-based and Zoom-based case management, referral connections for families to basic supports around the community, and home delivery of groceries, food, baby products like formula, diapers, wipes, things they could not access. We've also always supported referrals from over 150 community human service organizations for families that needed baby items. We're sort of the baby place in town. So formulas, diapers, things that you can't get at typical food pantries or your food benefit like SNAP, you can't get diapers with that. So families were really in desperate need. We had referrals for over 300 families that were being served by other nonprofits to receive those products and services. So as we come through the pandemic, the nursery is still open. We are continuing to do virtual services for families, and we see that as a permanent part of our program. We very frequently have families where mom or dad are incarcerated short-term or inpatient for mental health or addiction services. This really opened the doors for us to access them in a way we couldn't previously. Our community distribution will continue, as does our home delivery. So lots of innovation very quickly in the pandemic. It's going to be a permanent part of our program going forward.
For sure, I can definitely see that. I cannot imagine not only the services, but the logistics behind all of that. Kudos to you and your team.
Thank you.
The next question is for Andrew. What changes has Cleveland Can't Wait had to make in how you provide services during the pandemic? And can you describe what tools and resources have you needed to acquire or expand on in order to accommodate those changes?
Absolutely. Thanks, Patricia. So Cleveland Can't Wait was founded in 2019 by Justin Bibb. I came on shortly after. So we are pretty much in our infancy pre-pandemic, but our key program was an entrepreneurial builders program where we worked with students, teaching them business fundamentals, pairing them with mentors of color, business owners in the area to help them work on their own ventures. So we were incredibly excited to kind of scale that program in 2020 in March. And unfortunately, with the pandemic, we were unable to do that. So we really had to pivot our whole model. We took a step back and first started by figuring out how can we leverage the great work that's already being done in the community to create better partnerships. So we partnered with Chanel Wiggins-Smith and the Masks for Community initiative to help distribute over 70,000 masks to communities of color in the pandemic. And then secondly, since entrepreneurship and technology is a big part of our platform, we wanted to figure out how can we best serve the community with those talents. And that's led us to launch the Digital Land Initiative with Venture for America and the Mount Pleasant and Union Miles CDC, in which we worked with business owners on Cleveland's southeast side in the Mount Pleasant and Union Miles neighborhoods to help them compete in this new digital COVID work. Business owners we talked to did not necessarily have websites or emails or even Facebook pages. So we worked with volunteers to create these services for them to really help them in this new digital economy. The digital divide was an issue before the pandemic, but it was definitely exacerbated with the pandemic. We wanted to make sure that was a core service that we offered moving forward.
Yeah, you hit on a few great points. We're definitely going to talk about partnerships a little later on in this episode. Thank you for that and walking us through kind of what the initial plan was and what had to happen now. Victor, this question is for you. We've heard a lot of people say, especially in the health and medical community, that this pandemic, we've been building the plane as we fly it. Have there been past events, for example, the 2008 recession, that you've been able to draw learnings and wisdom from as you've tackled this crisis? Or has it really been entirely and completely unparalleled?
Thank you for the question. From my experience, this has been unprecedented, and I think for several reasons. One, just the global impact. Everyone around the world was touched by this. And then also just the combination of the physical, emotional, and financial impact that it had on people. So I do believe it's unprecedented. And as a result, and I'll speak for myself, not really going through this, it was really important for me to admit that I didn't have a blueprint to how to address this, and that it was time for me to, one, admit it, two, step back and allow people to, especially in the beginning, address this in the way that was best for them. Either in some cases, hey, I need to deal with this with my family on my own. In other cases is I need a virtual community to support me. And in other cases, hey, I need you to over communicate with me. Tell me on a regular basis what it's going on, even if you don't know what's going on. So I think as executive directors, we're problem solvers and we're constantly being asked to solve problems. So really being able to step back, let others step up, lead in their way, and address this was really helpful. And I think it does inform how we address these types of situations moving forward. I think the other thing I'll add is that, people really stepped up during this time, employees, staff, community, philanthropy really stepped up. And I think one of the common themes is that we don't know how to address this. So we're going to knock down some of these parameters and barriers that we had. And we're just going to let you try address this as best as you can. I think as a result, we all came out stronger.
For sure. Thank you. And that segues so perfectly for Jessica's question. Is president, CEO, and is an employer, we've all had to be aware of how this pandemic is impacting not just the people we serve and our families, but also our workforces. So what special steps have you taken or strategies you've incorporated to the people who work for Big Brothers, Big Sisters?
That's a great question. I think it's something we all have had to think about. And at Big Brothers, Big Sisters, I always say that we're in the business of building authentic, supportive relationships, whether that's between the kids we serve and our volunteers, but it also applies between the staff and each other and the internal culture within the organization. So for me, it's been important to recognize that, it's not just all of a sudden everyone's working at home. We're all trying to figure out what we're doing in the middle of a global pandemic that no one has experienced before. And it brought things to light and difficulties to everybody's right in front of their noses that you didn't anticipate, and trying to juggle, everything with your family and your personal life and your work life, and having it all intersect was a huge challenge. So I think, first of all, just recognizing that and holding some space to acknowledge it and talk about it and just recognize that that is what is going on has been helpful. I see a lot of babies in our staff meetings and, just really welcoming the fact that we're having this meeting in your home. So it's going to be a little different and look a little different than if we were all sitting around in a conference room, but just understanding that those standards are going to be a little different. I think that has been a really big part of it. And then also just making the time to check in one-on-one with everybody, make sure that everyone's doing okay, see if there's anything we can do, trying to do little nice things for everyone. We're a small team at Big Brothers, Big Sisters. There's only a few of us. So, it's worth the time because, to really make sure that we're all operating the way that we need to be and feel supported. Our organization used this opportunity to move out of our office space to kind of cut down on our overhead costs as we were, going through such an uncertain time. So, all of a sudden you're working at home permanently too. So that changes, you have to add in structures and supports that you didn't have while we're sort of in this semi-permanent work from home time. And not everyone is their own best self-advocate. So, not every employee is going to say, hey, I'm missing this or I need this. You kind of have to really be deliberate about inviting them to share their needs.
That's a good point. And what I hear you say is a lot of care and concern, right? And how do we express that, to our staff, our coworkers, our volunteers, our partners, all of everyone. So this
sorry.
Oh, yeah, absolutely.
I think we also have, it's not just with employees too, but even amongst leadership and nonprofits. I know especially very early March, April, there were a lot of conversations. I know I had one with Victor that was like, how's it going? And everyone's like, I don't know. And so, very early we were talking a lot about the importance of those social connections and, call 5 people a day for 5 minutes, and really maintaining all of those social connections for everybody has been helpful. And that's changed in the last year. But, really holding space for that too, I think is really important and helps a lot.
Oh, for sure. For sure. I think those check-ins, and here we are approaching March of 2021. And so what do we need to do, or what do we need to maintain? So this question is for everyone. If you can tell the audience, maybe 30 seconds to a minute, how has your organization responded to this time around forming new partnerships with other organizations? And I know a few of you kind of alluded to that, or made a couple of statements, but we hear time and time again, partnership, collaboration is so important. So give us some of those examples and stories of what you've experienced.
Happy to jump in. As a relatively small organization, we found partnerships to be invaluable. I always think of the saying, if you want to go fast, go alone. If you want to go far, go together. And I think, as a small organization, we really focus on trying to have the biggest impact possible. And that's been more so the case, definitely in the pandemic. So we partnered, as I mentioned, with Chanel Williams-Smith and the Masks for Communities initiative to help distribute over 70,000 masks to communities of color, and then partnered with the Digital Land Initiative with Venture for America and the Mount Pleasant Union Mile CDC to really help that southeast side of Cleveland continue to grow and develop digitally.
Thank you. And whoever wants to go next.
I could go next. I think there's 2 partnerships that were critical for us during this time. One, started pre-COVID, was a partnership with Cuyahoga Community College to turn our space into an access center. So basically bringing the college's resources to the Clark Metro neighborhood. As a result, we started some investments in our space that included technology and space and signage, which was very helpful as we then transitioned to a virtual environment. During last year, we actually continued the investment in preparation for eventually coming back, and then the opportunity to become an academic learning pod with United Way, Cleveland Foundation, where students, CMSD students, are actually coming to our space 4 days a week. So as a result of that investment with the Access Center, we've been able to now house these students, and they have the proper broadband and equipment and staffing to be able to take care of that. So those have been 2 critical partnerships for us over the last year.
That's good, because I think, go ahead.
No, go ahead, Patricia.
No, I was going to say, it's, we know there are people who are, really having a tough time, and then it's those who really want to give, like, how can I contribute, or, either individually or from that organizational standpoint. Go ahead, Natalie.
No, I was just going to say, I alluded to, the relationship with our human service partners. We were all contacting each other, leveraging resources, making sure to connect to clients in any way, including non-traditional partners. For us, to the ability to reopen safely, we had relationships with, the CDC and the Cuyahoga County Department of Health and Metro Health System, but really bringing them all to the table together to help develop protocol and really come up with some best practices allowed us and them to move much more quickly to reopen, but also inform similar organizations about some of the practices and solutions that we discovered together. So there was a lot of learning together, a lot that was really valuable in this process.
Yeah, I agree with that completely. And I'm a big fan of collaboration in general. And I saw a lot of strength-based collaboration where this, when things really struck, there was a lot of disruption in the way that people were able to provide their services, but some people had really strong strengths that worked really well. So connecting cross organization and leaning on each other and sharing ideas or information or, content or, a lot of different ways for all of us. Because I think we all recognize that we're working with a lot of the same people. We're our service areas overlap. So, a family that gets services from Providence House, if they have an older child, might be part of Big Brothers Big Sisters. So, really recognizing that has been an important piece of collaboration, I think, for us. We have some organizations where we, and I think Natalie mentioned before, you're receiving referrals from other organizations, which is huge. For me, I joined Big Brothers Big Sisters right at the beginning of 2019. So I'd only been in my role for about a year. And, was really 2020 was going to be my year to get out in the community and, meet people and do networking. And I've been, trapped in the attic of my house now for a year. So it's very different. I think networking has to be more deliberate now than it was before. You're not bumping into people or, Cleveland is a very small town. You meet people, people. That has been challenging for sure. And it, you lean on your stronger relationships, and I'm very direct also generally. So I have in a lot of my conversations with people said, I need a little bit of help meeting people and, attending things and knowing where to go, just because the landscape is so different and it was already new. We also at Big Brothers Big Sisters have launched a family resiliency program over the summer with some funding from the Cleveland Foundation's COVID-19 rapid response. So we have also been doing what we can to pass support directly through to families, which is not something that we'd ever done before. So, whether that's we're referring them to other organizations to meet their needs, but now we are able to support more of those critical needs. So whether that's helping a family that's going to experience a utility shutoff or, needs to buy something like a refrigerator for their family that's expensive, but they need it. We've been able to do more that way, which has also changed the way that we're able to support our families and our interactions with other organizations too.
Yeah, thank you. Thank you. You said a lot of great things. And I could say I definitely miss running into people at coffee houses, right? I would make my rounds, east side, west side, south. It did not matter. And it would be very typical that I would run into at least one person unexpectedly, and it would be a 30-minute conversation. I miss that so much. Quick reminder to the audience, thank you again for joining us. If you have questions, if you have feedback, go ahead and drop that in so we can start weaving it into our conversation and know how to allocate time towards the end. This next question, I want to gear it for Victor and Andrew. So unfortunately, it has been well documented that the pandemic, we have had problems during this pandemic with equity and health disparities, even before everything came to light. And what has become more and more common for everyone, that the pandemic has shed light on the disproportionate impact on communities of color. So with the work you have been doing, with your experiences, what is your advice or any observations you would offer on how we can better serve communities of color?
It's a great question. So I think, that's something that we think about a lot at Cleveland Can't Wait. And I think the process really starts with really engaging the community you're looking to serve. We always start with doing focus groups with either residents or business owners we want to help with. I think that you are not going to be able to know the problem as well as they do. And to understand what their key pain points are before making any real decisions, I think is key. One of the things we noticed when we had these focus groups is the lack of access to information was a critical pain point. So I think if we talk about, how do we get, relief grants, whether it's city, state level, how do we make sure vaccine information goes out to various communities? How do we make sure that businesses are ready to apply for grants? A one-size-fits-all communication strategy may not work. So you have to understand how to really communicate well with the community. So for example, when we had the Digital Land Initiative, while we were all remote and we were able to, get volunteers remote, most of the businesses, again, weren't available via email. They're really in kind of their businesses. So we had to figure out how do we actually engage that community kind of by, phone banking, by non-contact canvassing, leaving flyers outside of their business location. So really understanding the best way to communicate with the community you're trying to serve is crucial in helping to break down some of these inequality gaps.
Thank you. And yeah, thank you for the question. I think that, what you're seeing is really, it's the result of our country's history, and our country's history of oppression, racism, that has led to, these health disparities and also this lack of trust. And we're seeing it with the vaccine, right? People are, I have conversations all the time where, well, what are the Tuskegee experiments or the forced tubal ligations in Puerto Rico, unbeknownst to people, what does that have to do with today? Well, those are the points in our history that lead to the lack of trust today. And we need to come to terms with that and accept that history does matter and that history does impact our present, and that we need to tackle that. So that's why I think big picture, this anti-oppression, anti-racism, equity work is so critical for all of us. And, that engagement is critical, and it has to be authentic engagement. It can't be this top-down approach where, our scientists, our doctors know what's right for you. That's part of it. The science is part of it, but it's also how do you build that trust again? And that takes a lot. And hopefully, I do hope that people have learned through this process, once we're past this, that we can't forget about it and then wait till the next crisis, that we have to continue that work over and over. It's an everyday job for us to continue breaking down those disparities so that when we face this again, we're able to move at the same pace and same speed.
For sure. And thank you both for mentioning that. And I can say from the public health perspective, what we're seeing is a huge amount more awareness and accountability, more declarations, how racism is a public health crisis. And, unfortunately, it took COVID for more of this awareness and accountability to bring kind of everyone up to speed. Some of us have been working in this space for a very long time. I definitely do not want to exclude Natalie and Jessica from this discussion. Jessica, did you want to add something, or Natalie?
Yeah, I just think it's important to highlight part of Victor's point that the pandemic was, we've all heard it being described as unprecedented, maybe more than any of us ever wants to hear again, but it didn't change anything. It revealed a lot of what was already there and revealed it for people that weren't paying attention before or weren't aware before, but the realities for people are not the thing that changed. So it's been great to see more people understanding the realities of some of these impacts of things like systemic racism on the people that, we're all working with. But those disparities have existed for a long time. So it's, you can, and we have recognized it more during this time, but also I think it's critical to make sure that awareness continues, but it doesn't stop with awareness. Just to know about a problem doesn't fix it. So, really being active and focused and centered and grounded on what we can do to erode those barriers and remove those existing conflicts is, I think we all maybe realize now how important it is, but it's always been important.
I totally agree. Go ahead, Natalie. Yeah.
No, I would add, I think as much as the awareness and it revealed all the things that we've all been trying to educate the community about for years on lots of issues, I think it also helped people understand how close to the edge they are. This became a reality for people that felt they were stable in jobs, felt that their family income was appropriate, felt that their housing was safe or their health was good. And it very quickly turned for a lot of people who've never experienced crisis, marginalization, lack of access. And so I think people's minds opened in a different way, that if they hadn't had to face that moment of truth, that moment of crises in their life, they were like, wow, how fast this happened, how fast I got here. And they were, I think, more prepared to hear the messages that we've been trying to communicate in a more stable environment that wasn't sort of sinking in. So it really, I think, it lifted the veil for a lot of people.
Yes. I think we're seeing that, and we're working through this process. So Jessica and Natalie, switching gears a little bit, nonprofit organizations rely to varying degrees on fundraising to support the work they do. So how has your organizations had to make changes to your fundraising plans, or have your funders been able to make changes in their funding approaches and requirements? We know a lot of foundations have changed. There's the Rapid Response Fund in Cleveland, and in other counties as well. So if you can, walk us through some of that, the fundraising approach, donor relations, and then how Champs Give Back campaign fits into your overall funding strategy.
I'll jump in. So Providence House is almost 90% privately funded. Our annual budget is $3.8 million. So it's a big can to kick. The impact of COVID, so the increased cost of all the equipment and safety and sanitation and extra staff to support that, combined with the lost fundraising revenue, particularly special event gatherings, is over $900,000 to our organization, a third of our budget. That was unexpected, unplanned. We have been really fortunate that most of our events, we were very quickly able to, jump in as an early adopter for virtual events, continued to try to host them virtually, reach out to our donors. The donors that have been able to retain employment have continued to be generous and supportive. A lot of high touch work. So, sending emails, reaching out to donors that are really regular supporters, checking in on them, making sure they're okay. Really leading all of our donation requests with empathy. Like, we don't know how this is impacting you, but if you're finding your way through and you are able to support, wow, we would really be appreciative, because we're struggling. Foundations were great about pivoting and relief funds. The Paycheck Protection Program allowed nonprofits in, was really helpful for so many of us. So it was sort of cobbling it all together. But at the core, I always tell our team, we're here. Providence House exists for two reasons: the children who need us and the donors who support us and allow us to be their hearts and hands. And so we really, as heavy of a lift as we did for our kids and families, we did the same with our donors, just staying in touch, staying in communication through social media, through websites, through virtual events, through mail when it got through. Stuff was really late, so some of the timing there. But I think that knowing, we did a lot of video updates, quick, like 1 minute. Hey, we had to temporarily close. Here's how you can help. Hey, we're reopening. Here's how you can help. These sort of immediate, in the moment, they felt connected. And I think that is something that's going to have to continue as we come out of the pandemic, whatever that looks like. Hybrid events, not everybody's going to be comfortable coming back together, continuing to communicate with donors with changes coming in the organization. For us, probably the thing that just sort of came to a screeching halt is we're trying to expand to the east side of Cleveland. So we are on the west side, but serve all over greater Cleveland. But we had over 500 children will not get in, waitlisted or unserved, and 70% of them live in east side zip codes. So, we're kicking that back into gear, but we were in survival mode like so many other people.
Yes, I think the connection is key, right, for donors, funders, organizations throughout. Jessica, what would you like to add?
Yeah, I think it's interesting because so many of us went through different versions of, similar challenges, especially even between our 4 organizations. We're all in very different places in our organization's life cycle. And, Cleveland Can't Wait is brand new. And there's been a leadership change at Big Brothers Big Sisters in the last few years. Natalie and Victor have been running their shows excellently for longer than I have, So we're all in different places, but have faced a lot of the same challenges, especially with events getting canceled and, everyone's moving to virtual. I'm sure we're all trying to plan events for the same Saturdays in June and July right now, because it's when it feels like it's going to be the safest. And I think strong fundraising is always based on authentic relationships like everything else, and really understanding, for me, I always say everybody has a mission that speaks to their heart. And that could, I am actually a little sister through Big Brothers Big Sisters, so I'm an outcome of my own program. So for me, I'm incredibly passionate about giving other kids the opportunity that I had. So, I stay grounded in that, and I say that to everybody, and it's going to resonate really strongly with some people. And some people are going to be more interested in working with maybe younger kids, or they're passionate about animals. But you always have to be presenting yourself and putting yourself out there so that people have the opportunity to say, yes, I want to be part of what you're working on. So for us, it's really been about, and again, 2020 was my second year in my role. So it was a lot of, figuring things out, but really making sure that we're messaging and reaching people and giving them the opportunity to say yes and asking them to support us. It did also give us the opportunity to make some changes where, a lot of organizations have established fundraising events that, maybe for years, the fundraising staff has wanted to change, and there wasn't a lot of opportunity to do that. So there has been some opportunity in adversity in all of this of forcing us to adapt, allowing us to adapt, encouraging us to adapt, or at least ask ourselves questions maybe we wouldn't have asked of, is this really working? What could be better? Should we try a different strategy? It's been, I think to be successful, you kind of can't just do things the way they've always been done. You really need to question and shake things up as much as possible. So, this kind of forced our hand on doing that. But I think also all of the work of all of our organizations has become even more important as people's lives have gotten more difficult and the struggles have gotten bigger. So, the need and the urgency for all of us is greatly increased. So it's making sure that we're letting people know, because all of our services are more important than ever. And it's been nice to see the Cleveland philanthropic community rise to that occasion in the way that they, really dug deep in their pockets to support, especially the COVID rapid response efforts. And really, invested in helping organizations get through from an operational standpoint, and then increase services and impact within the communities that we're serving. So I just saw something the other day that said that Ohio was in the top 5 of most giving states in the country. And, I think we see that reflected in Cleveland, that, people are very charitable and supportive of one another, probably because we are such a small town in some ways. So really, getting out there and asking and talking to people and spreading the word about your work. And, that's really what it comes down to for me, I think.
Thank you. I definitely appreciate what you were saying. And so, how do we embrace change, right? And I'm reading a book right now, The Eye of the Storm. How do we embrace change and conflict? And, are we made to change? Do we embrace it? All of that. I do want to address a question that came in through the chat, and anyone can answer it. Is there anything you can suggest as to what the general public, man on the street, can do to rebuild the trust that has been lost due to racial discrimination and disparity? I believe it needs to be individual efforts and not just government or business taking action.
That's a big question. And I would ask maybe if we could establish an operational definition of the trust that has been lost. Like, are we talking about the trust that has been lost in our institutions or our police force or between individuals? Like that could go in a lot of different directions, I think.
Yeah, I could, I think in relation to my answer earlier, I agree 100% that it starts with the individual. And, I think the role of government, there's different components to this, right? There's your policies, your practices, those things that are mandated, but it does start with the individual from educating yourself, to making intentional efforts to be cognizant of your privileges, be it white privilege or male privilege or the gender. I mean, just the list goes on, and being cognizant and conscious and taking intentional steps to, again, educate yourself and address them and listen when people say this is oppressing me or holding me back or a barrier. So that it starts with that overall awareness and commitment. So, yeah.
Thank you. Anyone else want to take a stab? Is there anything you can suggest as to what the general public, kind of the man on the street, can do to rebuild the trust that has been lost due to racial discrimination and disparity?
I think one good way to, like Victor said, recognize the ways that you have privileges that other people don't is getting yourself out of your bubble in terms of the people that you interact with that maybe look like you or in the same economic class than you, have the same opinions that you do, and breaking out of that a little bit. Still, is an individual action that you take and is within your own sphere and your own control, which means that it's something that you can do very easily, whether it's finding an organization to participate in their, to volunteer with or to learn more from, or, questions you can ask yourself or conversations that you have. The more we all widen our perspectives in a vulnerable and open way, I think it really, helps build back some of that trust to some extent.
100% agree with what Victor and Jessica have said. I think, we talk about listening, having a conversation, listening to someone who does not necessarily have the same shared experiences with you may sound really easy, but I think it's very rare in practice to actually really open up, really listen, and really engage in that dialogue. So I think it really starts with trying to understand someone who has that perspective than you.
Thank you. Thank you so much. So I have one more question, and I think there's a couple more in the chat. And this question is for everyone. So I know we've talked about what was happening pre-pandemic, where we are now. We're entering, still on this unknown timeline. We still have uncertainty, but, we still want to plan. And planning is important, for strategic reasons and all this good stuff. So as we plan for 2021, 2022, and beyond, what do you see as some of the ongoing or lasting impacts of the pandemic for your organization and the people closest to you, the people that you serve? And everyone can answer that.
I could go for it first. I think one of the positives of this past year is that it really opened our minds and eyes to different ways of delivering our services. And as a result, we actually expanded our geography. We're actually serving students around the state and some from out of state, and also just a variety of tools. So as we look into the future, definitely this idea of a hybrid approach, whatever works best for people, either virtually or in person, and not just clients, but also staff, having that flexibility. And then also just from an education perspective, this idea that education doesn't have to occur in the classroom, that there's a lot of different ways of delivering these things. So that's very exciting. And again, just has opened us up to this, sounds cliche, but this world of new possibilities that we're excited to explore.
And I would jump off that with Victor, for our organization, I think for the successful organizations, nonprofit or business that have come through the pandemic healthy and invigorated and innovative, we weren't focused inward. How do we survive? How do we make it through this? We pushed out immediately. We said, how do we get this to our clients? How do we get this to the people who need us? How do we change service models so that we're not making them come to us in this really challenging time? We're finding a way out to them. And I think that there were some public policy changes, at least for us as a children's organization, that were required. And, kudos to both DC and state of Ohio. They moved quickly. They made it happen. It was urgent. They were also facing outward and saying, we absolutely cannot leave children and families and the elderly and people in poverty disconnected. We need to change the way we do business. And so, that slow moving ship turned quickly. And it was necessary for all of us to make the immediate pivots to become outreach focused and not have, again, people coming to us for the services. So I think it's going to radically change. As Victor said, education doesn't have to happen in the classroom. It can look different. The work we do doesn't have to happen in our shelter on our campus. We served more families during the pandemic than in our history. We just served them differently.
Wow, good points. Mm-hmm.
Yep, and I would add too that I think in some ways, and maybe this is a trauma response to living through the pandemic for a year, but I very much have internalized the feeling of like, I cannot predict the future. But also that stability doesn't necessarily mean that you can predict the future, and it doesn't come from a place of predicting the future. So, really facing forward, knowing that being nimble and being able to adapt is going to be something that's with us for a long time, and is a skill set maybe that, like Natalie said, those of us that have really tried to adapt and have learned to thrive in a difficult environment will carry with us. For us looking out over the next few years, and I think probably for all of us, the need is only going to continue to increase. Like the pandemic doesn't end tomorrow. It doesn't end when vaccine distribution is over. The impacts of this, our communities are going to feel for a long time. So making sure that we're continuing to take those lessons that we've learned and to be outward focused, like Natalie said, and to really, for me, it's inviting more people to the party in terms of doing good work in the community and giving them the opportunity to do that. I think that will continue to increase, especially since people have been more generous than I would have been able to expect. But, again, I learned I couldn't predict the future. So
to take it back off that, I think adaptability is definitely something that we're going to have to take with us moving forward. I think the partnerships piece too is something that we're going to continue to leverage going forward. We've learned how important those relationships can be, and we want to continue to create partnerships with great champions for Cleveland in the area. And then finally, I'd say, the digital divide was an issue before the pandemic. It was definitely shown to be an issue during the pandemic and will likely be one after. And so we want to continue to figure out what can we do as an organization to help that digital divide and help scale more digital initiatives across the city.
Yes, thank you. So we're going to start wrapping up, and here's another question for everyone. What has been your proudest accomplishment among your organizational efforts during these unprecedented times? And I think, it's very important that we celebrate the small wins, right? Daily, weekly, monthly, and then looking back over this past year. So what is your proudest accomplishment during this time? Whoever wants to go.
I have two I could share. One, the Family Resiliency Program that we were able to launch with our Cleveland Foundation COVID Rapid Response funding, and the way that we've been able to prioritize giving direct support to families in a way that we never have before, has been huge, and our families feel that impact, So, and my philosophy was very much, if we can do whatever we can to give people cash assistance, like, I feel like that's what people need right now. So how do you help meet that critical need, But also very early in the pandemic, when we were in that call 5 people a day, really connecting with each other, that whole wave, I was able to, through a process of just trying to be a good steward of our donors, I had a donor reach out and just during our conversation say, I had a little brother back in the 1970s, and we lost touch in like 1975. And I used my millennial Googling skills, and I was able to find the little brother and track him down and reconnect a big brother and little brother that hadn't spoken since, I think it was 1975. And, they had been separated, and, life moved on. And again, as a person that, my big sister is still my best friend. So I know how important that relationship is, and to be able to reconnect them and to give them that moment with each other was probably like the most special thing I've ever done in my career. So it was really a wonderful thing. And I've stayed close to both of them now. So, again, it's all about relationships at the end of the day, I think.
And I would say, like Jessica, I've got probably 2, one on the inside and one on the client side. On the client side, our goal is really to not only keep children safe in our crisis nursery, but then work with those families to create safety and stability so that the family remains together. So reunification, preventing foster care placement is our number one goal. And through the pandemic, we have had 100% of our families successfully reunite through the program. And as I said, we've served our largest client population ever, including those community referrals. And internally, we made a commitment very, very early on. We provide 24/7 care. The majority of our staff are childcare providers that are working around the clock and shift on hourly jobs. And we made the commitment not to lay off and not to furlough. And we kept everyone employed. There were some weeks where they weren't working at all, and we used it for training opportunities, facility preparation opportunities to mobilize the workforce and keep them engaged. But we did not lay off or furlough a single member of our team, because our childcare providers, a lot of them are single parents themselves, and they're only a paycheck or 2 away from being a client for us. And we just could not, given our heart and our mission and our compassion for families just working to survive, we could not do that to our own team. And so we successfully retained everyone through the pandemic.
Go for it.
Okay. I'll give you the last word. So very similar to Natalie, I'm very proud that we also didn't have to lay off, furlough anyone. And, to this day, I just hear from staff how appreciative they were, because they had a lot of colleagues and friends and family who weren't as fortunate. So I'm very proud of that. And also, that was a board decision as well. That was a collective decision that, hey, we have a little money in the bank and we have to dip into that to make sure that we don't lay off people. So very proud of that. And then again, very similarly on our client side, not just the continuation of services, but really the expansion of services. And during a very difficult time for them as well, when they needed an organization and people. So again, very similar as everyone else. So thank you.
I think for us at Cleveland Can't Wait, from an outward-facing standpoint, we definitely were incredibly proud of the work done for the Massive Communities Initiative. Distributing 70,000 masks and other PPE at an important time in the pandemic was huge for our organization. I think internally, just seeing the amount of support from volunteers we got during this process has been amazing. We got tons of volunteers willing to kind of come out on a Saturday to go kind of walk the Union Miles, Mount Pleasant neighborhoods, middle of winter to go meet with these businesses. I think to see the support for what we're doing from the community, from our volunteers, from our partners has just been, incredibly inspiring, and definitely will fuel us as we move to the post-pandemic times. Knock on wood.
Thank you all. Oh my gosh, the time went by so fast. I'm so happy we were able to cover such ground and really hear your experiences. I'm glad we ended on this note of accomplishments and things, to look forward to. I hope the audience learned not just more about the organizations or individuals, but how this work impacts the greater Cleveland area, and that people are working so hard to serve our communities. Thank you all for attending this episode. Again, a very special thank you to each of you, Natalie, Andrew, Jessica, and Victor, for sharing your perspectives and insights with us today. This has been recorded and you will be able to access it later on, or feel free to share it with your friends, family, and network. Please stay tuned for other upcoming Bright Talk presentations, and feel free to view our on-demand talks, and you can see how hospitals have also responded to the pandemic. Lastly, we would really appreciate your feedback on today's episode and suggestions for what you would like to hear in future episodes in this series on COVID-19 and leadership in the area. Please use the rating feature below. And on that note, thank you and have a great day. Bye for now.